And we make sure that we take it to the individuals who are able to make the laws and make change happen. It's to protect and promote your rights, and then to have your views and wishes genuinely considered when decisions are being made about your lives. So keep in mind, we want to hear your voice, and it is important for us to understand what you all need us to share when it comes to advocacy. Now, this year we decided to share information on something that we thought is a very important program that you'll learn more about in the future and on this call. We decided to highlight the peer support program. So your agenda will first have some legislative champions recognized by Ms. Daneault. Then we'll go into peer support specialist information by Ms. Stephanie Stout. After her, we'll have parent peer support by Dr. Joy Hogge. I will speak about peer support specialists on the youth side, young adults. And then we'll hear from some actual peer support specialists. We have a young adult peer support specialist, Ms. Justine Farrell. And then we have a forensic peer support specialist. And that's quite an interesting title. So you'll learn more about that from Mr. Keith Windsor. And last but certainly not least, we'll have some important updates from the Department of Mental Health Executive Director, Ms. Wendy Bailey. And then we will talk about our call to action, because of course, advocacy always ends in a call to make some action. So we'll go ahead and start out with Ms. Daneault from the Executive Director of Mental Health Association of South Mississippi.
Thank you so much, Sitaniel. I appreciate being here today. So our legislative champions, we wanted to talk about Representative Kevin Felsher and Representative Carl Meekins. They co-sponsored House Bill 732, which was later approved and signed by the governor. And what this bill is all about is it helped Mississippi to implement our 988 Comprehensive Behavioral Health Crisis Response System, which is in compliance with the National Suicide Hotline. The intent was to ensure that all Mississippians are able to receive a consistent level of crisis services, no matter where they are, no matter where they live, they work, or if they're traveling in Mississippi. And actually, you can use this 988 nationally. It's a national number for behavioral health. And we know that 911 is what people use for crisis situations that emergency responders like police or ambulance would handle. But 988 is just for the behavioral health side, for those crisis situations that a behavioral health professional can talk with them about and handle. So the bill also provided for members of the study commission and for adequate funding to support the sustainability of the call centers and the services. And so we sent just a little token of appreciation to our two legislators who introduced the bill. And we just hope that they know how much us and everyone in the state appreciates that went forward, because it's a huge step for our country. And really, why did we as a group, why did we decide to talk about peer support and make that the topic for today? Well, it's all about certified peer support professionals. And we had conversation about professionals. It is a professional. People go through a training. It is a recognized title in our state, and it's very important. So we just want to highlight what's happening here in Mississippi, that peer support is sustained by research. It complements other services. It's person-centered, recovery-oriented, and being a peer support specialist can be very gratifying and empowering. And I can say that at Mental Health Association, the majority of our staff are certified peer support professionals. And I'm just honored to be able to work with them and so many other people who have provided these services. So now I'm going to turn it over to Stephanie Stout, who is the Executive Director of the Association of Mississippi Peer Support Specialists.
As Kay mentioned, I'm Stephanie, and I'm a peer support specialist also, meaning I'm a person in long-term recovery who works with individuals who have similar experiences as mine and help guide them through recovery. Peer support is an evidence-based practice for individuals with mental health illness and/or substance use challenges. Peer support has existed in behavioral health for decades, but in recent years, its growth has been rapid. Research and experience shows that peer support specialists have a transformative effect on both the individuals and the systems. Peer support has also been shown to improve the quality of life, improve the engagement and satisfaction with services and supports, improve whole health, including chronic conditions like diabetes, decrease hospitalizations and inpatient days, and reduce the overall cost of services. Peer support specialists are an essential component to recovery. In the past, it was thought that we should tear a person down to build them up, but that's not how peer support works. We start with hope and we focus on the strengths. We focus on what's strong rather than what's wrong. I know many of you have heard that several times. Studies show that peer support lowers the overall cost of mental health services and reduces rehospitalization rates or time spent in inpatient services. It actually increases the use of outpatient services. I've got a few little statistics that I want to share with you. And these are random locations where experiments were done. In one location, a 56% reduction in hospitalization rates were shown. Another showed reduce of involuntarily hospitalization by 32% by using peer support specialists. This is a savings of $1.99 million in 1 year. From a peer bridger program that served 125 individuals, 100% of the consumers had been hospitalized prior to having peer support services. And after that year, they were offered peer support services. And of the next year, only 3.4% were hospitalized. So, we talk about the things that peer support can do. And I know a lot of those statistics are for business, but for the individual, having someone who's walked that path and is there to walk that journey with them is priceless. It provides a feeling of hope from hopelessness, and that spark of hope can carry a person to reach their full potential. Now we're going to turn it over to Dr. Joy Hogge of Mississippi Families as Allies.
Thank you, Stephanie. And it's very exciting to be here with all of you, and especially, all of you. And I'm grateful for my fellow panelists because everybody's doing great work out there, and just to see so many of you on here. I'm Joy Hogge, and for those of you who don't know me, I'm the Executive Director of Families as Allies. So we're a statewide organization run by and for families of children with some sort of behavioral health or related challenge. So it might be a special healthcare need, it might be dealing with the juvenile justice system, but something that affects their behavioral health. And as parents and caregivers of children, and we're talking about children 0 to 21, we support each other and we work together to make things better for our children, like at the systems level and program level. So we've been around since 1992, and our parent organization, which is the National Federation of Families, has been around since the late 80s. So we've been doing this informal parent-to-parent peer support, as Stephanie said, for decades. And then it's been really exciting across the nation and in Mississippi as the formal service of peer support has grown and developed. And Stephanie's right, it's been exponential to bring that together with this grassroots family work of one family supporting another. So as part of that, we do the training for the Department of Mental Health for parent-to-parent peer support. And we've also, through other sources of funding, been able to extend that work and do this same thing with families whose children are involved in the juvenile justice system or child welfare. And we've also done work with families of children with special health care needs and looked at what does parent-to-parent peer support look like? What's the best way to teach one parent how to support another parent? And we want to all those things that Stephanie's talking about that are evidence-based. We want to make sure that we're doing it in a way that's been shown to actually work. So we've worked really closely with our national partner, which is the National Federation of Families, and they've identified certain competencies that someone doing this work should have in order to be effective. So we've based our training on those competencies, as well as what the state of Mississippi requires. And there's a lot of consistencies between those. And then also work to make sure that that our training works across systems, because children don't say, okay, I'm going to have a problem just in the mental health system today. They have their issues come up in all these systems. So we want to be able to support parents in any system where their child arises. So that's kind of how this training came to be. It is everything Stephanie said about peer support is true for parent peer support. The things that make it unique is it is the person with the issue, who's the child, is not the direct recipient of the peer support, it's their parent. So it's someone else getting the peer support. So it tends to focus, and all peer support helps people navigate systems. Parent peer support really has a lot of emphasis on that. And the systems that it tends to emphasize are different and systems that exist typically just on the child side. So education, K through 12, child protection services, and juvenile justice tend to be the systems where we most support families. And we also, like I said, deal with special healthcare needs and of course the mental health system as well. So if you have families that you're working with out there and they're having huge issues with the school, think parent peer support, because that's the most common issues that parent peer supporters help families deal with. Another thing that's I don't know if this is, I think this is unique. And we're also really lucky. Mississippi has laws about Mississippi's system of care for children's mental health. And we do a lot of, and we're lucky. It's some of the best legislation on the books in the country. We also support parent peer supporters in understanding that. So when they go to your organizations, they can help make sure things like MAP teams and wrap around are rolled out in ways that are consistent with their original intention. As I said, we work, everything we do is based on the Federation's competencies. They have a national model of certification that can go across systems. So we're also looking at how that might be something that could support Mississippi. As far as practical ways that we can support any of you who are working with parent peer supporters or who might want to be parent peer supporters, or who supervise them, we offer monthly coaching. And in fact, our coaching for parent peer supporters is tomorrow at noon. And that can be for anyone who's formally trained or anyone who is just out there learning to do this. We also do supportive conversations with supervisors of parent peer supporters quarterly. And I'll put information about, we have one of those at the end of the month to hear your concerns, to work on things. We are working with one of the mental health providers in the state to look at a very specific model based on those competencies of how to supervise parent peer supporters, because that can be really confusing when they get out there, especially if you're a mental health provider who's never supervised one before. And then we will help if you are out there working with parent peer supporters and need things like help with how to develop a job description, how to recruit, if you have a job posting or whatever, we will partner with you on that too. And one thing we've started doing is at the end of training, there's always a graduation. And we used to do ours with all the parent peers or with all the peer supporters. We've pulled it out and we do a graduation just for parent peer supporters, not because we don't love our other peer supporters that we work with. But we're using that as a recruiting opportunity and a way to educate people about parent peer support. So I'm going to put the information about that next graduation too. It's a great place to come if you're thinking, what does this actually look like? We share more information. It's a great place for someone to come if they're trying to decide if they want to be a parent peer supporter. Right now, we also at Families as Allies have some funding if someone wants to learn to do this work in the juvenile justice system. We have some funding for them to do training, and we just got some more funding for situations where sometimes there's someone, say at a church or wherever, who's doing this work very informally with other parents, and they would like to learn more. We have funding for those people too, if they would like to go through the training. And you can, if you have any questions for me or anything, put them in the chat. And now I'm going to turn it over to Sitaniel to talk about young adult peer support.
Thank you so much for that information, Joy. And just to kind of back up, I know Joy was sharing how to do all of the training for the parent peer support. The training for the adult and recovery is done by AMPS, and that is Miss Stephanie Stout. If you have questions about that training, please put it in the chat and she can give you more information about that and how often they are holding those trainings. But on to youth, young adult peer support. And please excuse me if you all hear me say youth opposed to young adults, because to me, it just goes hand in hand. But the last young adult peer support training was held in 2019. And that's in essence been 2 years since the training. So what's happening is we have had young adults that have shown interest in being a peer support trainer, a peer support specialist professional. And what has happened is those 5 young adults were put into the adult class and they became certified peer support specialists in that manner. So you might say, what is a young adult peer support specialist? That is a young adult who is between the ages of 18 and 26. And as you know, our young adults are already kind of leaning on each other for help. When there's a question, more than likely, they're going to go to each other opposed to coming to someone in a different generation. So our peer supports that are young adults are helping their peers in different settings, even if they're not trained. They are in church settings, they are in school settings, they're in college settings, they are just in our community, actually making the connections with young adults. So what we would love for the state to do is at some point we'll grow, because now we have family peer support, we have the regular peer support professionals, and we want to start to cultivate our youth peer support specialists even more. There were 10, I think, trained. Many of them are not working in peer support specialist aspects right now for various reasons that I'll disclose to you later. But what our goal is to increase the number of young adult peer support specialists and improve the young adult peer support program in the state of Mississippi. Because if you think about what they do, they're a very valuable resource to all of us. We want to make sure that what they do in their profession is conducive to helping the programs that they will actually be employed with. So we want to make sure their training and what they do is important and actually adequate for what is necessary in the mental health setting. And we actually did some surveys here at NAMI, Mississippi. We have another organization full of young adults called Open Up Mississippi. What Open Up Mississippi does is we offer the chance for young adults to come and share what's going on in their lives and make sure to help make rules and advocate and things of that nature for mental health. They get to be a voice for their peers. And from that, over the last few months, there was a survey done within the last year because we wanted to know how they felt peer support should go in the state for young adults. There were surveys done, and from those surveys, our focus groups with the young adults and the youth said that 86.8% reported the salary for that program was important. 90.8% reported benefits are important. 51.3% reported the ability to work from home is important. 79% reported flexibility in work hours is very important. And then 73.7% reported having their own office cubicle space is important. And 94.8% reported that having a job description with detailed responsibilities is important. And I know for our peer support specialists that are on the line now, you know that these things, although they come from our young adults, they are important in your job as well. So those are some of the statistics that our young adults share with us. There were also 25 providers that responded to an online survey in reference to youth and young adult peer support. And 23 of those respondents are responsible for hiring peers within their agency. And one of the things that they said, they would like to utilize youth and young adults in their programs. So that's very good to know that it's not that the service is not needed. We just have to move forward and make sure to cultivate the opportunity for young adults to become peer support specialist professionals. So one thing I wanted you all to kind of understand a little bit more of how a youth peer support specialist would be used in the field and how it can change the aspect of another young adult's life. So I'm going to share a short video with you all from SAMHSA. And for me, this video made all of the sense in the world. It kind of wrapped it up in a nice little bow. So here we go. So as you can see, that video showed clearly the youth peer support specialist will help an individual in their time of need because they can relate. As he said, relatability. So I want to share with you all Ms. Justine Farrell. She is actually a young adult peer support specialist. Justine, take it away.
Good morning, everyone. So my name is Justine Farrell, and I am a certified peer support specialist, and I work with the Stay Up program, which is part of Pine Belt Mental Health Care Resources. So we service ages 18 to 25 who have a comorbid substance use disorder and a mental health condition. So for me, one of the greatest things about being a peer support specialist is that your training doesn't start when you take the certification course. For me, it starts at birth. So as a child, I experienced all of the major types of abuse, as well as bullying and ostracism from my peers. And so growing up, before my autism diagnosis, I felt that there was something fundamentally wrong with me. And this is a common rhetoric. I've seen it in the individuals that I serve. And so I essentially fell through the cracks, and I only received services and help for complex PTSD and a dissociative disorder once I had disclosed what was happening to a peer. And so once I began receiving services, it was uncovered that not only was I severely traumatized, but I also had a severe case of anorexia and autism as well. So much like the individuals I serve now, I felt like I was the exception to recovery. I felt that I had been through too much, I had seen too much, and I just suffered too much to recover. And so I started self-medicating because that felt like the only option at the time. I felt extremely alone, and it felt like no one understood me or what I was experiencing. And so the only thing at that time that gave me solace was learning sign language, American Sign Language, and attending events at my local deaf center. They welcomed me with open arms, and signing gave me a voice after not having one for years. So that was really important to me. I spent years in the system being bounced from provider to provider until I got to my now therapist, Krista. But by the time I got to Krista, my BMI, which is your body mass index, it was 15. And so your heart can stop at a BMI of 14. So I was truly near death, and I did not see a way out. But eventually I realized that it was death or recovery. As my therapist, Krista, says, if you're not recovering, you're dying. And so I decided that I had been through too much to quit at that point. And so with the help of my therapist, I made a full recovery for my eating disorder. And when I graduated from community college, it was during the height of COVID. So no one was allowed at my graduation, not a single soul. But I scheduled a session with Krista for right after my ceremony. And I went into her office with my cords, my stole, my diploma. And I said, it's because of you that I was able to do this. So thank you. And so after that, I took a gap year to focus on my recovery. And I worked at an elementary school as an ASL interpreter and a special education assistant. So I got to give a child a voice. And so that hit home, of course, after all those years of feeling like I didn't have one. So it was then that I realized that social work was where I was meant to be. And so I began pursuing my bachelor's at USM. And so I wanted to make a difference in others' lives. And I thought back to what my experience was at the beginning of my own recovery and the loneliness and the confusion and the isolation that I felt. And I had no example of anyone else ever having braved recovery when I started mine. And so I had never seen someone else do what I knew was required in order to get better. So as a peer support specialist, I get to be that person for the individuals that I serve. I get to be a real life example and a reflection of their own strength and their own resilience. So I get to be who I needed when I was younger, and that means the world to me. So I recovered because someone heard me and saw me and supported me. And as a peer support, I get to take all of the ugly of my past and all of those years of feeling unheard and unseen and use them to make someone else feel seen and heard. So as I tell my clients, the only person who has control over your life is you. And you may not get to decide how your childhood goes or how your life starts, but the beautiful part is that you get to decide how it ends. And so my rough start helps others have a beautiful ending. And that is what makes peer support so worth it to me.
Thank you, Justine. That's
Oh.
wonderful.
Thank you, Justine.
I guess that's my cue. My name's Keith Windsor. I am with the Mental Health Association of South Mississippi's. My official title is Forensic Peer Coordinator. I'm sure some of you know what that means, and a lot of you have no idea, but that's why I'm here. I am a forensic peer support specialist. Forensic peer support is a person-centered, strength-based support system offered to individuals with mental health or substance use challenges who become involved with the criminal justice system. We all have clients who've had run-ins with the law, right? That's where forensic peer support comes in. Forensic peer support starts with initial contact with law enforcement all the way through re-entry into the community after release from incarceration. We are, my team and I are currently in the process of putting together a training for this module. We're going to be an official designation from DMH, and I'm going to get more on that in a minute. But to qualify for the training, you have to have lived experience behind bars. We like to say you have to have heard cell doors slam behind you to qualify to be a forensic peer supporter. I myself have been to prison in 3 states due to my addiction, but it's a miracle I'm sitting right here. We can all change. I would have imagined I'd be sitting here in front of you guys. There's 136 people here, and that's amazing in itself for peer support. But to give me a chance to give back and to help fellow people that have been involved in the criminal justice system and to help stop the revolving doors. I'm going to share a little bit about what I do, because all that technical stuff, we know clients who are involved in jail. My very first client as a forensic peer supporter was in jail on a commitment order due to his drug addiction. I met with him several times in jail, and he agreed to go to treatment. I worked with DMH, the diversion program, and that's the Department of Mental Health, for those of you who don't know, and the local chancery court, and got him diverted to a treatment center nearby under our care, which was Region 4 at the time. This was in June of last year. I talked to him last week. He's back home. He's been sober for over a year, or right at a year. And he's reunited with his family. And that's just one of my success stories. Not all of them are successful, but the point is we're giving people a chance to do something different. and trying to stop the revolving doors of the justice system, because there's too many people that are getting out and going back and getting out and going back without a chance to realize there's something different. Everybody likes numbers, so I got some numbers here for you guys. Out of 29 clients I saw during my first year as a forensic peer supporter, 18 are still out of jail and successful. That's a 62% success rate. With me learning on the fly how to be a forensic peer supporter, I am the first one in the state of Mississippi. There's only one more working right now, and we're both working on putting together the training module for forensic peer support. So we need more of us. I want to stop here and give credit to the AMPS team, Miss Sandra K. Ron and Miss Stephanie Stout. Those guys worked hard with MDOC to get us behind bars. We have currently incarcerated inmates who are being trained as we speak. There's some in the upcoming adult and recovery training, and there will be some in our forensic training when we get it off the ground. So it's an amazing job they've done, and they've given me a head start with our forensic things. Mississippi taxpayers spend $18,500 a year to imprison a single person. If we go conservative, I helped 18 my first year as a forensic peer supporter. If we count 10 people, 10 forensic peer supporters help 10 people keep them out of prison, that's $1.8 million we've saved the state of Mississippi. That's real money, people. Our state has a 77% recidivism rate. It's one of the highest in the nation. That means 3 out of 4 people who get out of prison are going back within 2 years. We got to stop that cycle. I'm living proof that people can change. Like I said, my history, I could tell you all my story all day long, and half of y'all probably wouldn't believe most of it. But I've been in Mississippi my whole life. I love the state. I love peer support. I was doing peer support a long time before I actually became a peer supporter. But this is my passion, and I want to help people and give them a second chance. So we need your help to help them. Get involved, people. Thank you. I think I'm turning it over to Sitaniel.
Yes, we wanted to make sure that we also included our wonderful Mississippi Department of Mental Health. So now we will see a message from the director of the Department of Mental Health, Wendy Bailey.
Good morning. I want to thank the incredible group of advocates who helped organize today's event for inviting me to join you for Mental Health Day at the Capitol 2023. It's an honor to work with such a talented and devoted group of leaders who want to have a positive impact on the state's mental health system. As we embark on a new year, there are several initiatives that will be a focus, including a particular emphasis on crisis services and peer support, which is the focus of today's event. First, I would like to briefly talk about 988. As many of you know, 988, the 3-number call system for the National Suicide Prevention Lifeline, which also serves as a behavioral health crisis line, launched nationally last year on July 16th. A planning committee from Mississippi, including several of you who are participating today, worked for more than a year before the launch to create a solid roadmap for the implementation of 988. There have been many successes over the last year, including formal protocols for dispatch of mobile crisis response teams when needed, videos highlighting our amazing call centers in Mississippi, awareness efforts, feedback surveys, and more. Mississippi's 2 988 call centers deserve a tremendous amount of accolades for helping Mississippi have one of the highest in-state answer rates in the nation throughout 2022 and continuing into 2023. This work would not be possible without the support of planning committee members, which included stakeholders such as people with lived experience, law enforcement, providers, advocacy groups, and more from around our state. Both Sitaniel and Kay have been an instrumental part of the planning and awareness efforts. Mississippi Families as Allies has gathered feedback from family. Chairman Sam Mims and Representative Kevin Felsher introduced legislation last year in support of 988, along with Chairman Bruce Hobson and Chairman John Polk, who supported funding 988 implementation and continuation in the ARPA legislation for mental health. Enhancing our state's crisis system in 988 will help bring hope to hundreds of thousands of our citizens in our state and further our mission for people to be served in their local community. Last year, I mentioned the ARPA proposal that was submitted to the legislature that focused on initiatives to enhance the state's crisis system for behavioral health and for people with intellectual and developmental disability. Implementation of these initiatives is beginning this year. This also includes more crisis stabilization beds, enhanced training to serve Mississippians who are dually diagnosed with a mental illness and intellectual and developmental disability, adding court and law enforcement liaisons to connect people with community-based services to decrease the number of commitments to the hospitals, training for law enforcement, and enhanced funding for mobile crisis response teams. It also includes funding to pilot 3 peer support respite programs that are voluntary short-term day programs that provide community-based non-clinical crisis support to help people find new understanding and ways to move forward. The evidence is firmly behind the impact that peer support can make in a person's recovery journey. Over the last several years, peer support has been incorporated as a component of mobile crisis response teams, programs of assertive community treatment teams, intensive community outreach and recovery teams, and other areas throughout the mental health system. Our incredible certified peer support specialists, or CPSSs, in this state use their lived experiences in combination with training to support their fellow peers and family members who are experiencing a mental illness or a substance use disorder. To further enhance the emphasis on peer support in our state, we provided funding to the community mental health centers to employ CPSSs at all crisis stabilization units in the state. Peer support workers often take the lead on engagement, and they insist with a continuity of care by providing that support that people need beyond the resolution of the immediate crisis. We also work to expand the Peer Bridger program to all state hospitals and the community mental health centers. The goal of the Peer Bridger program is to enhance the transition process from a state hospital to the community, to decrease readmissions and increase the number of people who attend follow-up appointments by working with their Peer Bridger. We are proud in Mississippi to have the Association of Mississippi Peer Support Specialists, or AMPS, which is one of the day's sponsors, who is providing groundbreaking work that is, even as we speak today, being reviewed by SAMHSA as a possible national model on consumer engagement and inclusion for their development of the consumer pathways to inclusion and engagement model. The well-developed and executed model that AMPS led efforts in creating can bring an even stronger voice to peer support in Mississippi and hopefully across the nation. The power of peer support is a game changer. It is the definition of providing hope to the peer specialist and to the people they work with. As one of the first CPSSs in our state has said, quote, "My light bulb, so to speak, didn't come on right away. Until one day after a presentation, I began to realize deep down that I was not the illness. This was an important step in my own recovery, to be able to recognize the separation between my person and the illness. They are not the same. When I was first diagnosed, I became that diagnosis. That was a huge setback for me, and I became lost in the It crippled me. The very concept of recovery was unfathomable. I truly needed to understand and clearly see that I am not an illness. It is something I have, but it is not who I am." Sandra Caron, who spoke those words, uses her personal recovery to make a difference in the lives of others and to further peer support in our state. It is because of her and the hundreds of other peer specialists in Mississippi that recovery is the focus. There is much more work being done across the state by staff, community providers, peer specialists, advocates, families, and in partnership with other agencies. And there is still much work left to be done. I look forward to continuing to work with all of you, our families, our community partners, and our state leaders to develop and support innovative initiatives that will open doors to improving the overall health of our state. But most importantly, that will bring hope to us all. Thank you.
And I would also at this time like to ask Ms. Stephanie Stout to share how an individual can become a peer support specialist if they are interested.
Well, thanks, Sitaniel. If anyone is interested, they can go to the Department of Mental Health website, and that's dmh.ms.gov. And under the services, peer support services, scroll down to the bottom, and there's documents, which will have an application to all of the trainings that have been mentioned. AMPS is responsible for the adult and recovery module. And then Dr. Hogge for the parent peer support. And right now, the young adults will still be taking the adult recovery. And then hopefully we'll have the forensic peer support module out. So we're excited about those. Also, Peer Bridger is another peer support program that's on the website also. And that's working with individuals out of hospital settings and help them integrate back into the community. So they're all really well. The trainings are great, and it really equips peers to work with individuals.
Thank you so much, Stephanie. Our goal is to make sure that everyone in the state knows what a peer support specialist professional is, and if they need one, seek one out when seeking treatment. So I told you guys that we would have a call to action. And of course, with it being an advocacy day, our call to action is for everyone to promote peer support as a valuable profession that can improve the entire system of care. How can you help? You can advocate for
Peer support across systems,
Billing models that allow peer support to be delivered across systems.
And the national certification models to increase achievement of these goals.
And if you're interested in contacting any of our organizations, please pull the information from here. I've listed contact information as well as websites, and you can see what each of us do. And again, we want to thank you all for joining us at the 2023 Mental Health Day at the Capitol. If you have any questions, again, please feel free to reach out, and thank you all for attending.